what does recovery look like?
Look, is recovery a person?
No, the process of recovery.
Absolutely. Recovery is much more than just stopping drugs. It
Okay.
involves building physical health, building mental health, fixing relationships. It's not a single event. Reintegration back into society definitely starts from treatment, maintaining sobriety, going back into employment, ensuring you have a job, keeping you busy for those who need to go back to school. In certain spheres, we say addiction is a family disease because it affects everyone.
Hmm. This is a child that is supposed to be, in quotes, in a private university with security. There are some requests that children would make, and you as a parent, you should be suspicious. I know sometimes it's way beyond our control, but there are some checks you can do. This one, we're having pretty young people that are into substance use. From a developmental and psychological standpoint, how should parents start talking to their children about substances? What are the practical ways we can do that? Do we show them videos? Do we show them real consequences? Good evening, everyone, and welcome to another breakthrough session with your mental health sentinel and advocate, Oghenevwiere Nabena. Tonight, we're tackling a truth we can no longer ignore: addiction. We have with us a voice of both experience and authority on this topic. It's my pleasure to introduce our guest today, Dr. John Umogbai. He's a medical doctor, a mental health physician, psychotherapist, and internationally certified addiction treatment professional with over 15 years of experience. Is the CEO and medical director of the Barbies First Healthcare Limited, providing comprehensive treatment for substance use disorder and rehabilitation service in Nigeria. He has also led addiction treatment services across the country, including facilitating the NDLEA 247 Drug Addiction Call Center. Dr. Umogbai is an advanced member of the International Society of Substance Use Prevention Professionals, ISOP Global. Is a member of ISOP Nigeria Alcohol Policy Committee, bringing both clinical and policy level expertise on addiction and recovery. For him, this work isn't just a profession, it is a mission. Welcome, Dr. John. We appreciate you taking the time to speak with the mental health sentinel community. Thank you very much for joining us tonight. According to the United Nations Office of Drug and Crime, an estimate of 14.4% of Nigerians aged 15 to 64 used drugs in 1 year. This is nearly 3 times the global average. Research also shows younger people going into drugs. We have them being introduced to drugs before the age of 15. When someone battles substance use, it's never just one person's struggle. Parents carry the shame, spouse carries the burden, friends get really worried, often not knowing how to help. And through it all, in Nigeria, silence is still the default response due to shame and stigma. You hear them saying, please, nobody should hear it outside. So tonight, we are having to see how this substance abuse is becoming not just an immediate problem, but a problem for the entire society. According to the UNODC's Nigeria country's representative, it describes substance abuse as a crisis, not just for public health emergency, but also a development, security, and peace-building issue. That is how big drug abuse or substance abuse can affect us as a people. So yeah, some real stories. We have a final year student buried under exam pressure, decides to take a pill because she was told everyone use it. Today, she's a school dropout living in a slum. Her parents do not even know how to help her. We also have a young secondary school boy. He just lost his father. The pain of grief became unbearable for him. A neighbor handed him a wrap, just one puff. He wasn't looking for a habit. He just wanted to stop the hurting. Today, he cannot survive without it. He has graduated to harder substances because the first dose no longer numbs his pain. The cases are endless. Dr. John, thank you very much for joining us. I would like you to help us understand about substance abuse, and from your experience, what are 5 common reasons why people start using substance? Over to you, Dr. John.
Thank you very, very much. It's a pleasure being here, and I really appreciate that I am allowed to do this. Substance abuse, or do we say more appropriately, substance addiction, for the context of today's presentation. We must first understand what addiction is. Addiction is a chronic relapsing brain disease or brain disorder characterized by the compulsion to use a certain substance or do that activity despite knowing the negative consequences or the negative effects. Why do we say it is chronic? Chronic means it is long term. Relapsing means that it can reoccur over and over again. So the individual is doing better, they can relapse, they can go back to it again. Now, it is very important that we understand that addiction has certain characteristics. There would be tolerance. So usually, if I take alcohol as a case situation now, the individual starts with 1 bottle of beer. And after some time, that 1 bottle does not give them the desired effect that it usually gives them. So they have to increase to 2 bottles, or they have to increase the frequency of use, and then increase to 3 bottles, 4 as the case may be, or 1 stick of cigarette increasing to 2, increasing to 3, or increasing the frequency of use. We say that individual has developed tolerance. And in an attempt to stop or reduce the quantity of use, they experience what we call withdrawals or withdrawal symptoms with increased cravings for the substance. Then we say that this individual, right, has developed levels of dependency towards it. Does it affect several aspects of life? Yes. People have this idea or this phantom idea that for one to be addicted, they have to be seen as vagabonds on the streets, all tattered and all of that. That's not the case a lot of times. So by the time it's affecting one aspect or 2 aspects of or 2 areas of the individual's life, then we understand that that person cannot stop. Then we say there's a problem. For instance, your spouse starts complaining about your substance habits, and you are unable to control it and you are unable to stop, or it's affecting relationship with family and loved ones, despite knowing that you are unable to stop, then there's a problem. If, for instance, it's affecting finances, or is affecting education, or is affecting your job, and you know very well, and everybody can see, and they're talking to you about it, and you're unable to stop, then we say this individual definitely has a substance issue, and then we can assess for addiction. Are there common reasons why people start using substance? The reasons are endless and not specific to anyone in particular, because people could have different reasons. Some could just be out of fun, some could be out of curiosity, another person could be probably they were going through a medical condition and then they couldn't cope, for instance, difficulty sleeping, and in that bit someone else says, you know what, why not try this or try that, it will help you sleep. and then you start and then you get hooked on it. Remember, these substances are high stimulants and can result in a big problem. A lady recently called me. She was in the UK. Someone gave her my number and she said she wanted a prescription for a certain medication for sleep. That would I be able to help her? That her brother
Mm.
was coming over to the UK and she wanted him to bring it. And I asked, why would you want me to prescribe this medication? And she says, oh, she's been having difficulty sleeping for a while. And some friends have told her that the medication is very effective. You
Mm.
could see, you could see that. And so she wants to try it out. And I said, this is a controlled substance, it's a controlled medication. I can't prescribe it to you just like that. I would have to assess you and understand the reason why you are having insomnia, why you're having sleepless nights. Then we can deal with that. If we have to prescribe the medication, good and fine, but I wouldn't even prescribe it for more than a few days, not at most, not up to a week, at most 5 days. And this lady said, oh, okay, in that case, she'll get back to me and all of that. And I can tell you this is over a month now. She hasn't gotten back to me. And a lot of times, even medical professionals have made that mistake. So people can get into substance for different reasons. Some could be peer pressure. Some could even be having a psychotic illness or some other experiences, pain or something, and they're not able to cope with it. And someone is saying, you know what, why not try this or try that? Try this drug, try that pill, try this. Why take alcohol? It will help you sleep. Why not smoke weed? And then they start from there. So the reasons are endless, non-specific. We can't say this is the commonest or not the commonest. It depends on the individual, their environment, their exposures, what exactly is going on with them. We've had people become addicts to pentacocin because they were going through pain or they went in for surgery and it was prescribed to them and they felt amazingly well and okay.
Mm.
The pain just disappeared and then they went looking for it and then got addicted to it.
One thing I can pick is you can actually get addicted to a medication that you self-prescribed, even painkillers. So we should be cautious about that. So how can someone tell they are getting addicted or are already addicted, doctor?
That's a very good question. For the purpose of family members or loved ones who are around the person, so not just the individual, because a lot of times the individual may not even be aware that they are already addicted. Some may be conscious of it and can't stop. Some would even defend their addiction. However, what's very important to note is that beyond the fact that you are now developing tolerance, which means, like I explained earlier, you're starting to increase your use, either quantity or frequency. That's one major sign from the individual's perspective. When they try to stop or reduce the quantity, they start developing intense cravings or a desire to want to use the substance, or they start having withdrawal symptoms. Withdrawal symptoms can be non-specific depending on the substance, from poor sleep to appetite to mood swings. It depends on the substance. That's another lecture on its own if we have to go in there. Then loss of control, which means that I can't help myself. Yes, I now want to stop, and I realize that I try a few days, a few weeks, a few months, before you know it, I'm back on again. So that means failed attempts to quit, to actually quit. Then you now find out that they now start spending time either trying to obtain or also trying to use the substance. So they spend considerable amount of time, like they normally would not do, right? For some people, they start neglecting work, it starts affecting school grades begin to drop, performance at work begins to drop, relationship with family begins to drop as well. Some people begin to isolate themselves because obviously you can't be around those who are not using. Then you find out that they now start associating more with certain kinds of company that definitely we will not want you around. We want you around, then we know this kind of people are, you begin to look into that. Um, Other things one can notice as a loved one around such an individual You begin to notice certain paraphernalias around, maybe cigarette wrappers or cigarette stumps or the paraphernalias for crack cocaine, some of all those things. You begin to notice some of these things around. Definitely change in behavior from normal behaviors that you know this individual. He used to be outgoing, speaks well. Now he's isolating himself or she's isolating herself in the room, not wanting to talk to anyone, not wanting to associate. You notice irritability, mood swings can come up, poor sleep at night. So,
Mm.
really paying attention. In the context of use, some would notice red eyes and some other things. Also, poor self care, weight loss, depending on the substance. For very stimulating substances, high stimulants like cocaine, methamphetamine, and the likes, you notice there'll be less need for food. So they start losing weight. Self care and hygiene begins to drop. You notice this person is not what they used to be. So by paying attention and seeing that shift or that change, you can begin to notice.
Thank you very much, Doctor. In our last session, we spoke about cage, where we were told that if we notice about 2 yeses for the questions on cage, we should know that we need to make further investigation. So if you missed the last session, you can also get details on that. So, Doctor, from your experience, what are the emotional and psychological tolls on those people taking care of their loved ones that are addicted?
All right, thank you very much. Psychological toll on family, loved ones, and people around such individuals. Family members can begin to experience fear. A lot of times, you don't know what exactly is going to happen with this individual. Anxiety, fear, or
We seem to be having network issues. Okay, it's out. Depending when he rejoins, all right? So a few weeks back, we were having a session and we got a report on how, okay, doctor, welcome back.
please permit me, I had to change my location.
All right,
I
that's
think the
fine.
network.
Welcome.
So, psychological effects that it can have on loved ones, family members, ranging from fear, because sometimes we would have experienced some one or two aggressive outbursts from such people. Apart from fear, anxiety, addiction does not just affect the individual, it affects everyone around them. Imagine trying to deal with a situation that you've tried over and over and over again, and this individual does not even want to seem like they're willing to help themselves. You hear family members say things like, this person is so ungrateful, not appreciative after everything we've done, but failing to understand that they can't control themselves. And that's the biggest issue there. So they've lost control. Family members could also experience shame. And I can tell you that if I'm not mistaken, and this is me being very minimal here, there's hardly any family that does not have a substance case in the country today,
Mm,
directly or indirectly. It's that bad. Now, and because of that, they hide it due to shame. So nobody wants to talk about it. Nobody wants to talk about the problem in their family or the problem a son or daughter is causing. Then anger, obviously, it would definitely affect their emotions. They begin to get angry, they begin to get irritable, you begin to find communication difficult within the family dynamics, right?
mm,
Helplessness. Apart from helplessness, anxiety, depression, burnout, it's very, very tasking having to deal with this. Burnout. And then obviously financial stress because
mm,
it's not easy and it's expensive trying to manage this, getting one to go through treatment, going through a rehab. For children, children may develop poor academic performance, emotional insecurities, low self-esteem, behavioral problems, increased future risk of even substance use because the other younger ones in the house are seeing what's going on. Some are modeling from the elder ones. So there's a risk of even the younger ones going into substance at some point. And that's why in certain spheres, we say addiction is a family disease because it affects everyone.
So, doctor, a few weeks back during our session, we got a report of a child being disowned by her parents because they found out that she was into drugs, which is quite sad. And it got me thinking, whose job really it is to fix addiction? Like, what is the role of the parents to recovery compared to the role of the family and community?
Okay, that's really sad. That shouldn't have happened, and that's probably because they didn't have enough. They're not well educated about it, and they
They're
didn't
talking
have
about.
enough information about it.
Mm,
Addiction is the responsibility of everyone. It's not just the individual because it's beyond just a behavioral problem. No, like I mentioned, it's a brain disease. It's not just a behavioral flaw. These substances has affected the individual's functioning, how they think, how they feel, ultimately how they behave. And that's why they need treatment, as evidenced by the symptoms that they exhibit and the changes that have happened in their psychological functioning and their behaviors. Yes, the family has a role to play, very important, as a support system. Beyond the family, the entire society has a role to play. The workplace, the schools, the churches, the mosques, everyone has a role to play in addiction. As we can see, it affects everyone, and that's why everyone has a role to play. So, for instance, you would agree with me that a lot of people who go into crime, right, or who do certain things that are not expected of them in society, definitely would have to be on substance to help them. So that means that individual is a threat to everyone around them.
mm,
We're talking about banditry, we're talking about criminalism here, we're talking about kidnapping and all of that. You can ask the law enforcement agencies, all of these people, most of them are under the influence of substance because they wouldn't do this in their right functioning. You can see, now let's get into the school. We hear of young people joining cults, doing a lot of activities, even student rapes and all of that, assaults and all. By the time you do a drug test, you find out that these students were under the influence of substance as well. So whose role is it? It's not just the family. Yes, the family is the very first fundamental unit, but beyond the family, we also need to be involved in this preventively.
mm,
If schools put in measures to ensure that students do not, um, they have stated clearly that they have a no substance policy in the workplace, in the school, in organizations. You can't get a job or you will not be allowed into function if you are caught with substance because it would affect productivity at work. Remember, it affects everything. It's an epidemic. It's a global pandemic, if I have to say that. The
yes,
whole
it is.
world is crying about substance. So we can't just leave it to the family or the individual. So what's important is that that person, that lady needed help. The family could have stepped in. Okay, how would she have helped herself? Because the individual needs saving from themselves.
Mm,
They're not making right judgments. They're not making right decisions at that point. And they don't have the capacity to do that because they are ill. And then
mm,
you leave them on their own to go on the streets. What do you expect? She's going to be left in the hands of bad influencers who would further escalate it. Oh, come with me. Beyond that, she'll be at risk of so many things. Being a lady, and not just a lady, men, kidnap,
mm,
rape, let's call it. It's untoward. It can really be very, very bad. Everyone has a role to play. The media has a role to play. Mainstream
mm.
media. We should stop glamorizing substance use in our songs and all of that. What exactly are we propagating? Oh, yes, the artist wants to make money, but he's singing about weed, Igbo, Colorado. Colorado is a brand of, I don't know if you understand. And what
Over
dances with, and then they're
defining.
smoking. Yeah,
Yeah.
they're smoking, showing money, attaching glamorous life to substance use. Some of these artists may not even be using it. They may
Mm.
not they may not even be engaging in that act. But what message are they passing? They are influencers to the young ones. They are influencers to a lot of people. And then we see a lot happening. So even the government has a big role to play in policy making. We understand the role of the church and the mosques and the religious houses as big influencers. So it's not just the role of the family, it's not the role of the individual alone, it's everybody's responsibility. We used to miss those days back in the day where your neighbor could actually caution you and it won't be a fight, or the school could
Yeah.
actually take some measures and then the teacher is not going to be arrested by the family. But let's not go into that. That would bring in another conversation that's not for today.
Yes, yes. Thank you so much, Doctor. We can see how important it is for us all to come together as a society to help save children, neighbors' children, teachers. You have your role to play. Sometimes some people are trying to help, but they are somehow enabling the substance use. So, can you tell us what's the difference between enabling and supporting?
Okay. The difference between enabling and supporting.
Yeah.
When you are enabling, right, directly or indirectly, you are doing things that allows the individual, or should I say, gives them a pass to engage in that behavior. Oh, I love my son so much. I love my daughter so much. You just give them a pass. They manipulate you, and then you give them a lot of funds that are not needed for them. You allow them go to places. You reduce your discipline in your control of their activities or even monitoring them. So why would your child go out and you won't question what they've gone out to do, or they are coming back with certain friends and you're not cautioning that? You can say such an individual is being enabled by that particular parent. And usually, someone within that environment will be telling you, look, you are, in our Nigerian terms, you are spoiling that child.
Yeah.
You are spoiling this person. Do you understand?
Mm.
And yes, but in the context of a conversation like this, we use the word supporting. You are supporting the individual out of the use. So when you say supporting, you help the individual recover and become more independent in the context of their recovery.
Yeah.
You are encouraging responsibility and accountability. That's someone who is supporting. So,
We've lost Doctor again. All right. So, speaking on enabling, I got a report over the weekend of a boy that was missing, and his parents noticed something was wrong. They did some investigation. This is a child that is supposed to be, in quotes, in a private university with security. We don't know how the child got the access to go out, but with some investigation, they found a 19-year-old in a hotel somewhere in Abuja, living life, vibing, imported a babe, and he's been collecting money from his father. There are some requests that children would make, and you as a parent, you should be suspicious. I know sometimes it's way beyond our control, but there are some checks you can do. Early exposure to social media is also a big problem. During a training, we were shown a particular video of children that were vibing, smoking, and they were really small. Doctor, welcome back. I would like you to please tell us, this one we're having pretty young people that are into substance use. From a developmental and psychological standpoint, what should parents do? How should parents start talking to their children about substances? What are the practical ways we can do that? Do we show them videos? Do we show them real consequences? Just help us on that. Thank you.
okay, before I get into that, I would track back so we understand the difference between supporting and enabling better.
Okay.
Right. What we need to do is begin to support them. So let's imagine someone. these young people having substance challenge. You begin to support them by you help them recover and become more independent. On the contrary, an enabler would make it easier for the addiction to continue. You can see the difference. By supporting, you encourage responsibility and accountability. But when you see an enabler would protect the person from the consequences of their actions. Oh, don't touch him, don't touch her, let him be now. Do you understand? Yeah, it's just weed, it's just cigarette, leave it. Supporting would mean setting healthy boundaries, motivating treatment and recovery, and it's usually done with empathy and wisdom. Enabling, on the other hand, you are removing healthy boundaries, delays or discourages treatment. No, don't go for treatment. In rehab, we hear that this treatment is this and that, right? Or is often done out of exaggerated love, sometimes mixed with fear. You hear parents, I don't want my children to suffer what I suffer, and they begin to allow them or indulge them in certain activities, thinking they're allowing them live a better life or to avoid conflict. So these are very important things to consider and to take notes. Now, what do parents do? Like I always tell people, there is no handbook for parenting. It's quite difficult. The way child A is trained is different from the way child B is trained by the same parents. By the same parents. It's quite difficult being a parent. And those of us who are parents, we really understand this. Personalities differ, temperaments differ, a lot of that. Time availability. But what's important is from the very beginning, some practical ways that you are able to teach children is keep communication open. Be able to have conversations with your child, know things about them so you can influence them positively. You are their first role model. They look up to you first before they look up to someone outside. When you see kids going, they'll say, oh, I'll tell my daddy for you. I'll report it. I'll call my mommy. Yeah, so that's a big plus. Keep communications open. Let them be free enough to talk to you and tell you things. So when someone introduces them to something or exposes them to an information, they can share with you as a way of double checking. You can also explain real life consequences to them. Not necessarily putting fear in them, no, but just making them understand so that when they come across it, it's not new to them, it's not fantasy. I've heard it all, I've seen it all, I've seen the consequences of this, I'm not going to do it. Then you need to begin to teach children how to refuse offers. Very important. How to refuse offers. Back then, when we're young, our parents used to be very high-handed and strict on that. You don't collect things from strangers or anything you bring. Let me see it at home first. What happened until we left for university? They can't see you with anything strange or anything new. But it's important, but you do this with love. So they're not doing it with fear, but they are genuinely coming to show you, look, I got this. And then you'll be able to educate them. Then you want to help children recognize risky situations as well. You've been there, done that. You've seen what they've not seen before. So help them recognize it. Don't be scared of having these conversations early enough. You'll be shocked what the internet is exposing your 5-year-old or your 7-year-old to without you knowing. So you should be ahead of that. Censor whatever they watch, whatever they see, wherever they go. This information is very important. You'll be shocked. Your child will just say something random from school. And then you're wondering, where did he learn this? Where did she learn this? But that's because you've kept an open communication. And that's why you can know that. A lot of people would not be able to, a lot of parents are too busy. Have time for your children. Not our fault. The economy is really, really difficult now, but we should have time for our kids. We must, and not just leave them to the hands of helpers. A child will go to school at 8 a.m. and is not returning back until 5, 6 p.m. And then daddy and mommy are coming back from work at 7, 8 p.m. Look, there's no interaction. how do you even want to know what's going on in that child's life? Who's actually training the child? So we must have time for them. We must help them build esteem, decision-making skills. These are soft skills that you must help them build, and you must be good role models. But I would always say this, if you have pictures and videos, show them, but be mindful that they must be age appropriate anyway. So depending on the age of the child, you must do that, so you can better educate them. Avoid content that glamorizes drug use, but then it's difficult to avoid in our environment today. Like I mentioned, videos, movies, artists, everything out there is just creating a problem and glamorizing substance. We can begin to teach our children what's best. Most importantly, as a parent, you can't give what you don't have. So you must try to be a good parent. A lot of times I say you must even try to be a good child. You should have been a good child before you become a good parent, because you can't give what you don't have. How do you tell your child to stop smoking when you are smoking? And you're telling them it's bad, but you're doing it and drinking in front of them. How do they reconcile that?
Makes no sense.
Absolutely. We could go on and on, but I think I'll just stop here
Thank you
for now.
very much, Doctor. Thank you very much. We are their first models. They learn from us like mirror. They see you as they see themselves. So, like Doctor just ended with, we can't be doing some things in front of the kids, what we expose them to. Social media is a big problem. You can't leave a child with a device and Wi-Fi, no supervision. I don't even think a child needs a device and a child. Let children be children. Let them play football or do something else with their time. Let them play with dolls. You know, I think we have a huge role to play as parents when it comes to this aspect of our children. We know there are lots of things they can also learn from their peers, like doctor recommended. You need to help them develop those skills to be able to say no and be fine about it, to be able to be different. You don't need to do something because someone is doing it. Be content with what you have. Is that eye of you want to get it all that will make you say, let me see what these people are doing. You want to belong. We should train our children to be able to stand out, not mix. So thank you very much for that, Doctor. So what does recovery look like?
Look, is recovery a person?
No, the process of recovery.
Absolutely. Recovery is much more than just stopping drugs. It
Okay.
involves building physical health, building mental health, fixing relationships. It's not a single event. Reintegration back into society definitely starts from treatment, maintaining sobriety, going back into employment, ensuring you have a job, keeping you busy. For those who need to go back to school, you're doing that the right way and getting the right support. Spiritual well-being also very important. Having a purpose in life, that is a lifetime journey. Building self-esteem. So recovery involves everything that makes the individual, because triggers are out there. Triggers can be people, places, things, even internal triggers as emotions, even family members. So recovery involves everything, and everything is considered and put into perspective, as long as it is for the benefit of the individual, all with the goal to ensure that the individual stays and maintains their sobriety.
Okay, Doctor. In Nigeria, we don't see rehab as common practice. So if we have someone that is going through an addiction, where can we find help? Do we have functioning federal or state rehabilitation center or just private? What do we have? What are our options?
I would like to commend the government, because they are also making efforts to ensure rehabilitation centers. There are some rehabilitation centers by government, and there are also state-owned rehabilitation centers as well. I know the FCT has one or two states mental health facilities or units are doing a lot. However, we must also ensure that the private space has a lot of rehabs. Majority of the rehabs are also in the private space. So there is help out there. There are rehabilitation and treatment centers out there. You just need to access them. Yes, people talk about the price and cost. Have a conversation with them and then see what can be done. See what can be done. In truth, what we have is not even enough for everyone, both by government and private. Not enough, but we're getting there, and more centers are coming up. Recently, I heard about the NDLEA setting up rehab centers in different geopolitical zones, standard rehab centers, which is brilliant coming from a government perspective. I would like us to do away with the stigma and the fear. I've heard people say things about rehab. I've several.
All right, we're having this session because we're also trying to work from the preventive angle, since we know our reality is the system is not there yet. So it's better we prevent having to get our loved ones or family members, everybody here on this call, it is your responsibility to also ensure we don't have more cases of substance abuse, because help is there, but it's not that cheap. It comes at a cost. So rather than going through the hard and the highway, prevention is always the better place to take. I know we are all excited about the World Cup finals, so we're trying to make this session as short as possible. So if you have any questions for Doctor, I would like you to drop them in the chat. We'll take them briefly. The ones that will not be able to take via call, we'll answer them in the community group. I just have one question for Doctor. Welcome back, Doctor. Okay, my last
Thank
question
you.
is there hope
My
after relapse?
connectivity is really.
So sorry about that. Welcome back. Is there hope after relapse?
Absolutely. Relapse does not mean the end. As a matter
Okay.
of fact, could be part of the cycle for a lot of people. Relapsing does not mean that the world has ended or that's the end of the journey. Remember, recovery is a journey. At some point, there may be a few slips here and there, a few mistakes here and there. A relapse may happen, but the individual would bounce back and come back stronger. When a relapse happens, it's important you go back, see your clinicians, get the appropriate help, get the proper guidance, figure out what exactly went wrong and what not to do again moving forward, get detox, become okay again, restart the journey. How will I put it? If I'm climbing and then I fall, does that mean I should stop climbing? Absolutely not. Because I now even have a better experience of the climbing, I could climb faster. So I will not be coming down to ground zero. I could easily pick up and get myself back. I would also like to correct a lot of misconceptions concerning rehab in the country. They're being stigmatized and all. I've had a family say something, oh, we heard that we want him to do an outpatient. He can't be in rehabilitation. We heard that they harvest organs in rehab centers. And I'm like, really? Where do you get these tales from? Where do people hear these things?
Mhm.
Please, rehabs are one of the best places that an individual could go in for help. Rehabs are built to be comfortable, convenient. We go with the biopsychosocial model. So, psychologically, physically, in every way, the rehab is meant to help and assist the individual and definitely protect them from themselves and from the harms that they are going through. It's a treatment center and also a place for behavioral modifications. So why would we have bad notions about rehabs? So please, even when a relapse occurs, from experience, people do better. People
Okay.
recover. There is hope. I've seen people go back to their lives, their families, go back to school and excel, get better jobs and excel.
Yeah.
The home front becomes perfect again. We've seen people do a lot better. So, yes, seek help, seek appropriate help, seek professional help. It's very important. I would encourage us to do that.
Thank you very much, Doctor. So we have a question here. Say, What do we do if we know of someone who is suffering from addiction and refuses to accept any help?
It can be looked at in two perspectives. If the person is a minor, then you can actually step in as a family or parent and all of that. For someone who is not a minor, an adult, and I know that's where it becomes quite difficult. They don't want to seek help. Try and convince them, talk to them. You can't stop. You can't stop encouraging them. Try and talk to them. Seek the advice of professionals. Seek the advice of a psychiatrist or a clinical psychologist. They'll tell you what to do, depending on the situation, because everybody's situation is
It's
different
different.
and we're all different people. Yes. Sometimes get them to speak to a professional. Some people are not even ready to stop, but it's affecting the entire family, it's affecting them at work. Some can't stop. They don't have it's they can't help themselves and obviously making poor judgments. So sometimes the family, the wife, the husband, those who have certain levels of authority over that person should speak to professionals, and depending on the situation of that individual, you'll definitely be given the best advice. But right now I can't give a blanket advice here because there are rules, there are policies, we have our acts that govern and guide our practices and all, and it's all tailored to the individual. But seek professional help as much as possible.
Thank you very much, Doctor. I know that
You're welcome.
I'm looking at my time because I want to watch the final, and I know you're also going to watch.
Mm.
So I think we can close for tonight. But before we close, I want to say plainly, like we've said earlier, shame and stigma keeps people sick, and people are not their diseases. If you're watching this and you have someone that you really love and is struggling, please hear me. You don't have to carry it alone, like Doctor have said. No need to keep quiet. Seek help. Recovery is possible. Relapse is not the end of the story. And support is not weakness. Um, Healing is a process, it's a journey. So every parent carrying shame, every spouse that's handling the burden, every friend that is being worried and concerned about their loved ones, you're allowed to seek help too. It's a collective duty. And this is a stepping stone for us. We hope to discuss more on this topic because it affects the community and the society at large. So thank you, Dr. John, for giving us your time and your wisdom today. And thank you all for watching. Protect your peace, guide your family, and remember, recovery is possible. Stay a sentinel and see you all at the healthier side of tomorrow. Thank you very much, Dr. John.
Thank you very much, and thanks everyone for listening. Bye.